Flexion distraction can be used to increase the intervertebral disc height, allow the nucleus pulposus to assume its central position within the annulus, restore vertebral joints to their physiological relationships of motion, improve posture and motion while relieving pain and improving body function. Spinal conditions treated on a motorized flexion distraction table: sciatica, general back pain, scoliosis, Facet syndrome, spondylosis, degenerative joint disorders, spinal joint fixations, sacroiliac joint disorders, spondylolisthesis. Adjusting is applying your specific technique to a spinal joint in motion. Use the same angles and line of force used on a non-motion table. As the table flexes, this forces movement in the spinal joints. With the combination of joint movement and spinal thrust, the joint becomes hypermobile. Thus, a lighter force is required for corrective movement. Stand close to the table and lean over the patient. A spinal adjustment is only given as the table descends. This procedure is used when adjusting the upper thoracic to lower lumbar spine. Because the joint is in motion, apply less force or thrust. Never apply a corrective force when the table is moving upward to avoid jamming of the facet joints. Seen in a chiropractor's office is acute low back pain associated with herniated or bulged disc. The following is an example of how to treat a patient with acute low back pain. As the table descends, be careful not to push or thrust on the L4 spinous. After the table has made 8 to 10 complete movements, stop the table and apply ice, appropriate therapeutic modalities, or light force adjusting techniques. This procedure decompresses the disc, decreases facet joint stress, and increases joint motion. After the patient